It started like a normal sore throat, but just 72 hours later, his life changed forever. Millions of people think strep throat is just a mild cold. They think all you need is tea with honey, a couple of painkillers, and some rest. But what if I told you that ignoring it could make it impossible to breathe, give you chronic heart problems, or even kill you? It sounds crazy, but tonsillitis is way more dangerous than most people realize. News headlines shock the world every now and then. Teen dies from a simple sore throat. Hidden killer, how strep throat can turn deadly. It seems like rare stuff, but it happens more often than you think. In this video, you'll see the shocking consequences of untreated strep throat, what it does to your body, the permanent damage it can leave, and when a simple sore throat turns into a real threat. At the end, I'll tell you one story that shocked even doctors. Trust me, you don't want to miss it. B2. This is Jake's story. He was 19, a college student, an athlete, always healthy. It started with a little scratchy throat. No big deal, just fall season. He thought it was a cold. The next day, it got worse, but Jake figured he could handle it. Why see a doctor for a little sore throat? 2 days later, his fever hit 39. Jake felt weak but still went to class, drank only water, and took painkillers sometimes. By then, his body was already fighting a bacterial infection, but he had no idea it was spreading into his blood. On the third day, swallowing became hard. It felt like someone was squeezing his throat. Jake still didn't go to the doctor. He thought he could just tough it out, but the infection had started spreading. 72 hours after the first symptoms, Jake ended up in the ICU. Doctors found a peritonsillar abscess, a serious complication of untreated strep throat where pus builds up near the tonsils and can block your airway. Jake needed emergency surgery to survive. This isn't just one story. Thousands of people worldwide end up in hospitals every year because they didn't treat strep throat in time. And pus-filled strep is only the beginning. The real danger is deeper. Next, we'll look at what happens inside your body when you ignore a sore throat and why strep throat is far from harmless. B3. Think strep throat is just a sore throat? Big mistake. When bacteria, usually streptococcus, get into your tonsils, your body goes into war mode. Tonsils are like the gates of your immune system. They try to stop the infection, but if you don't treat it, the bacteria break through. First, the bacteria multiply super fast. Your lymph nodes swell, your throat hurts more, your temperature rises because your body is fighting. But without help, antibiotics, or proper care, your immune system can't keep up. It can get worse. The infection can go down into your airways, cause laryngitis or bronchitis. Still not deadly. The real danger starts when bacteria get into your blood. That's when the worst things can happen. Peritonsillar abscess, pus around the tonsils, blocks your airway. You could suffocate in hours. Sepsis. Bacteria spread through your blood, causing a massive inflammatory reaction. Death rate can reach 40%. And that's not all. There's another silent, sneaky threat most people don't know about: rheumatic fever. It can start a few weeks after you waited it out, thinking the sore throat is gone. Your immune system, trying to fight streptococcus, may attack your own heart, joints, or kidneys. That can lead to permanent heart damage, all because someone thought it would just go away on its own. A sore throat may be the first symptom. In just a week, simple strep throat can turn deadly, and you might not even notice it happening. Sometimes tonsillitis causes something doctors know about, but the public doesn't. It starts small, but can end in disaster. Next, we'll cover the rarest and most dangerous complication of untreated strep throat. It kills fast, really fast. B4. You might think sepsis is rare, and it won't happen to you. But there's one complication most people have never heard of: Lemierre syndrome. It starts small. All it takes is one untreated strep throat. Bacteria go deeper into your neck and infect the jugular vein, the main vessel that drains blood from your head. An infected clot forms inside. This isn't just a sore throat anymore. It's a ticking time bomb. When the clot breaks apart, pieces with bacteria enter your blood and travel all over your body. They can reach your lungs, liver, kidneys, and brain. At that point, your body basically attacks itself. Everything happens fast. A few days in, the person's condition can get critical. High fever, extreme weakness, shortness of breath, and severe pain. Even modern medicine can struggle. Death rates are 25–30%, and some patients die just days after the first symptoms. A story that shocked doctors happened in Texas in 2023. A 22-year-old felt a slight sore throat. She thought it was a cold and didn't see a doctor. A week later, she was in the hospital unconscious. Doctors diagnosed Lemire syndrome. The clot in her jugular sent bacterial emboli straight to her lungs. She survived after 8 days, but now has serious chronic health problems. There are far more stories like this than you think. Most people don't even realize that a simple sore throat can cause this. So how do you know when strep throat is dangerous? In the next section, I'll go over 5 key warning signs. If you notice even one, you need to see a doctor immediately. B5. Listen up. If you have strep throat or a really bad sore throat, these 5 signs are serious red flags. They mean things could get life-threatening. Sign 1. Fever above 39.5 degrees Celsius that won't go down. If fever doesn't respond to medicine, the infection is out of control. Your body is fighting, but the bacteria are winning. Sign 2. Trouble breathing or swallowing. If it feels like your throat is closing, you feel suffocated, or you can't even swallow water, it could be the start of a peritonsillar abscess. This can block your airway in hours. Sign 3. One side of your throat or face looks very different. One tonsil bigger than the other, neck swelling, or one side of your face puffy. These are warning signs the infection is spreading. Sign 4. Rash on your body or tongue. This often shows up with streptococcal strep throat and can lead to serious complications like rheumatic fever. Red spots on skin or tongue? See a doctor fast. Sign 5. Extreme weakness and joint pain. This is one of the most dangerous signs. It may mean bacteria are in your blood, causing sepsis. Every hour counts. Even one of these signs is enough to get medical help immediately. Don't wait or hope it will pass. You might not get a second chance. Many think antibiotics are a cure-all. Take a few pills and it's fine. That's a dangerous myth. Next, we'll talk about why trying to treat strep throat on your own is risky and how the wrong moves can make things worse. B6. A lot of people think strep throat is just a sore throat and try to tough it out, but these common mistakes are what lead to the worst complications. Mistake 1. I'll just wait. It'll go away. This is the most common and dangerous thought. Ignoring a sore throat gives bacteria a head start. They don't just multiply, they start attacking other organs. Every day you wait can cost weeks in the ICU. Mistake 2. Picking antibiotics yourself. Millions of people take antibiotics just in case, without a doctor. The problem is not all antibiotics work on streptococcus, the main cause of strep throat. Take the wrong one or stop too soon, and bacteria survive, become resistant, and come back stronger. Mistake 3. Reducing fever too early. Fever is your body's weapon. It helps kill bacteria. Taking medicine too early prevents your immune system from working. The infection spreads faster. Mistake 4. Home remedies instead of proper treatment. Warm milk with honey is nice, but it won't kill streptococcus. Gargles, compresses, herbal teas, they can ease pain but don't fight the infection. Every minute spent waiting it out gives the bacteria an advantage. Mistake 5. Stopping treatment too soon. This is extremely dangerous. People often quit antibiotics as soon as they feel better, but bacteria are still alive, mutating, forming resistant strains. Then a simple strep throat turns into a chronic infection that's way harder to treat. Bottom line, strep throat is not something to mess around with. Wrong treatment can lead to abscesses, sepsis, and rheumatic fever. The good news, if you get help early and follow the proper treatment, most complications can be prevented. Next, I'll go over exactly what to do if you have strep throat, how doctors check for dangerous cases, and what the right treatment looks like step by step. B7. You already know strep throat can be dangerous, so what do you do if it starts? Let's break it down step by step. Step 1. Figure out if it's viral or bacterial. Not every sore throat is strep. Some are just viral and go away on their own. But here are signs it's streptococcal strep, the kind that can get serious. High fever, usually 38.5 degrees or above. No cough. Severe throat pain, especially when swallowing. White or yellow coating on tonsils. Swollen lymph nodes in the neck. If 3 or more of these are true, go to a doctor. Step 2. When to see a doctor immediately. 5 situations where you cannot wait. Fever above 39.5 degrees. Trouble breathing or swallowing. Swollen neck or lopsided face. Rash on skin or tongue. Fainting, extreme weakness, or severe joint pain. If any of these happen, get medical help immediately. Step 3. How doctors diagnose strep throat. It usually starts with a basic check, throat, lymph nodes, and temperature. But for an accurate diagnosis, 2 tests are used. Rapid strep test results in 10 minutes. Bacterial culture shows which bacteria are causing it and which antibiotics work. These tests make sure the right treatment is given. Step 4. What proper treatment looks like. Antibiotics, only with a doctor's prescription and complete course. Drink lots of fluids to flush toxins. Rest, your body needs time to recover. Fever reducers, only if temperature is above 38.5 degrees Celsius. Gargles or sprays can ease pain but don't cure the infection. Remember, strep throat is not something you can just wait out. The sooner you start treatment, the lower the risk of complications. Step 5. When it's safe to go back to normal life. Many people return to work or school as soon as they feel better, but bacteria might still be active, and your heart, joints, and kidneys could still be at risk. Doctors recommend blood and urine tests after recovery to make sure there are no lingering complications. Now you know what to do if strep throat catches you off guard. In the final section, we'll put it all together, explain why strep throat is not something to joke about, and what to remember forever. We'll also return to Jake's story to see how it ended. B8. Remember Jake? 19 years old, college student, athlete, full of energy. He thought strep throat was no big deal. He didn't go to the doctor and tried to tough it out. 72 hours later, he was in the ICU with a paratonsillar abscess. Doctors fought for his life for 6 hours. They saved him. Jake survived, but the consequences stayed forever. Constant throat pain, breathing problems, and a lifetime risk of rheumatic fever. Stories like this aren't rare. They happen every day. Every year, hundreds of thousands of people around the world end up in hospitals just because they thought, it'll pass. Many don't survive. Here's what you need to remember. Strep throat is not harmless. If untreated, it can cost you your health or even your life. Don't self-medicate. Don't take antibiotics without a doctor. Never delay seeing a doctor if symptoms get serious. Now you know what happens if you ignore strep throat. You know how it can lead to abscesses, sepsis, Lemierre's syndrome, rheumatic fever, and chronic health problems. You know the 5 warning signs you cannot ignore. You know how to act correctly to save your life. But ask yourself, are you sure your strep throat is safe? Or are you just hoping it'll pass on its own? Think about it. Your health is not a game. If you want the real facts about diseases, symptoms, and risks, subscribe. No myths here, just facts that could save your life. In the next video, we'll cover another disease that seems harmless but can kill in just a few days. You won't want to miss it.